Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, giving you the update from Albany Med on the coronavirus. Today is Incident Command Day 43. We made it through the weekend and still didn't get a haircut.
Yep.
We can report in the 5 counties the number of cases that are positive for COVID-19 is 1,521. Over the 3 days, Friday, Saturday, Sunday, that's about a 5% growth per day. We see additional outpatient testing going on, and so we'll see those numbers continue to grow. Inside here in the medical center, we currently have 63 patients positive for COVID-19. That's very similar to the number we saw on Friday. We've had 6 who were admitted and 6 who were discharged since Friday. The breakdown there is 37 on the floor, 26 in the ICU, and 21 of them are intubated. Fred, we've had a significant number who've actually come off the ventilators.
That's right, Dennis. Actually, 24 of the vented patients have come off ventilators, which is terrific.
That is terrific.
And one of our ECMO patients has come off ECMO today, which is fantastic. That's an individual who received the convalescent plasma as well.
So to remind everybody, the ECMO, extracorporeal membrane oxygenation, a very significant medical procedure that people have to go through in order to take the blood out of their body, oxygenate it, and bring it back.
The heart-lung machine, only at the bedside.
Right.
Yep.
So 2 people we had, one's come off the machine, one remains on.
One remains on.
And that person is also improving.
That person has gotten better after a procedure on Friday, yes.
Wonderful. Okay. The breakdown inside here also shows that of the people who are currently in the hospital, we have the youngest person is 27. So we have nobody in the hospital under the age of 27. And only 7 people are under the age of 40. So that gives you a breakdown on the numbers in the house here. Convalescent plasma. We've talked about convalescent plasma a lot. We have some great new news to give there as well. I'll begin with the numbers. Over the weekend, we transfused 11 patients with convalescent plasma, so that number continues to grow. And in addition to that, Fred, I think we have an update on the process.
So today, actually, we had a call with the American Red Cross to talk about the process. And they are gearing up. First of all, they're going to turn things around quicker, Dennis. So within 24 to 36 hours after we do a match, the plasma will be available for transfusion. Probably next week or perhaps the week after, they will have a process in place where they will kind of take us out of the middle of it. Donors will be able to contact them directly, and they will create pooled plasma. So then what we would do is order plasma for a specific patient, and it would probably arrive that day or the next morning.
That's wonderful. And I think that we heard today that beyond the ones we transfuse this weekend, we may have another 10 or 12 that are going to be candidates for transfusion this week.
That's right. And those products, that plasma should actually arrive. Some of it was going to arrive this afternoon and then tomorrow. So they've really sped up their process.
And we will probably later in this week celebrate the lab with some shirts, because I know it's National Lab Week.
Yes.
And so we definitely want to call out the incredible work that our folks in the lab do, because they've been central to this process going forward.
Absolutely. They've been working really hard on this.
Okay. Let's talk about something inside here with our workforce, standby leave. Let's remind ourselves how we got here. We began by taking about 1,200 members of our workforce, and they are now currently working at home, work from home. Then we took people who remained here at the medical center, and we said, let's take folks who are working in areas where they're no longer functioning, meaning some operating rooms that have closed down, some practice clinics that have been closed down and consolidated, and let's strategically redeploy those people within the medical center, doing things such as checking temperatures or doing tracing on patients who may be positive. Once we got to the point where we had found work for all those people, there were still some people where we didn't have any additional work for them to do on this campus. And as Fred has said many times, it's important to get them off the campus and home, just from a volume of people on this campus standpoint. That's standby leave. And we reported out last week that we would see the number of people on standby leave go up. We here at the medical center are still providing full pay and full benefits to those people who are working from home. And the managers are finding a way to rotate those who are sent home on standby leave and the people who are in the clinics back and forth. So what are some updates?
So as of today, there are about 250 employees here at the medical center that are on standby leave. And just to emphasize what Dennis said, the rationale there is kind of social distancing in a way. Don't have them come into the institution if they don't have to be here, and also to reduce the burn of our PPE, of masks and other kinds of equipment like that. The other thing I would emphasize is they're paid, so this is paid leave, and their benefits are covered.
So these individuals are not furloughed. These members are still on our payroll, and we actually consider them to be very valuable employees. And we know that in the near future, as the volume picks up again, those employees are going to be back here at the bedside working on patients with us. And so we're very happy to be able to send them home with pay, and we know in turn we're going to be happy to get them back as well.
And they're made aware that they have to be available to return within 24 hours if we need them.
Excellent. All right. Fred, what are you wearing today?
So I'm wearing a surgery shirt, and I'm wearing it for a reason. I want to emphasize something that happened on Friday. It was an email that I got from one of the orthopedists, and basically he was telling me about some of the difficulties his patients are having. So he's delayed a lot of surgeries, and he's got a lot of people in a lot of discomfort, a lot of pain, some of them even beginning to take narcotics now because of the pain that they're experiencing. And he wanted some advice, he wanted some direction from the medical center. So I responded to him, but I also included all of the surgical leadership here at the medical center in that response. And what I told them was that we trust them as surgeons to make the right decision. They need to use their best judgment, what's medically right for their patients, in conjunction with their patients. And if that hip or knee or spine needs to be operated on because of intractable pain or for some other reason, they need to go ahead and make that decision, and we will support them. We will support their judgment around those decisions. So I got some feedback. Several of the other surgeons that were on that email responded. They were thankful for some advice, some recommendations, and the support the medical center is going to provide them.
So the surgeons are often in the position of making very difficult decisions anyway.
Yes,
That's
very
what they
much so.
do. And so this is something that they're familiar with, and we trust them, as you say.
Yes, we trust them. We trust that they're going to use their best judgment in that one-on-one relationship with a patient. What's in the best interest of that patient?
Shared decision making.
You got it.
And I'm proud to be wearing a volunteer services shirt. These are very important members of our workforce. In many cases, they're people who used to be employed here and then after retirement came back and volunteer here. Or in some cases, they're college students who are here, and it's a whole range. But when I think about the volunteer services, I think about something I read this weekend, and it brought to mind this group, which is why I wore their shirt. So Fred, the virus is very contagious. They talk about the virus being very contagious.
Yes.
But there's other things that are contagious, which is kindness and empathy and patience and loyalty and a positive attitude. And I read this weekend, and it said, you don't have to wait to catch that. You can be the carrier. So I think on Monday we want to start with a positive, uplifting story, and I think about our volunteer services and how they represent, those traits, as does our whole workforce. So that's how we'll start today. That's how we'll start today. Okay? So very good. So here we are, and we'll be back again tomorrow. Once again, that we ask, please, you take care of yourself, take care of each other, and we'll see you tomorrow.